Big one is the healthcare.
Healthcare, yeah, healthcare.
So really. Access to quality healthcare.
Today, we are going to be talking about something that we can do or help people out to really make the right return.
Big one is the healthcare.
Healthcare, yeah. Healthcare
so
really.
Access to quality healthcare varies dramatically across the continent. Some people will go live there, and sometimes they will just come back home to do their annuals and their basic checkups, and they'll go over there, back there to live. And so they go back and forth. That can be an option for you. But the basic and the small, like the regular diseases out there, you know, we have medications available that you can have access to.
Yeah, there's definitely access. But again, it depends on where you live. I think I interviewed Dr. Strebo, the president of the Ghana Medical Association, and he was telling us, and incidentally, just by the way, I was listening to some video. I was watching some video that said rated the top-notch hospitals, and a lot of them are actually in Africa, believe it or not. So we have the institutions there, but there's not a lot for the whole population. So if you go there and you need to be taken care of, you have the places to go, especially if you an expat or a returnee. You have access to some of the top-notch places. In Ghana, there's a University of Ghana Medical Center. There's a lot of other places, the Kwalebu Teaching Hospitals. That video that I watched said that is the top hospital in Africa. It's in Ghana. And so there are several places. There are private hospitals or private clinics also right there. But again, we don't want you to just go. You have to do your homework. Where the area you're going to live, where is the place that you're going to seek care if you have to, whether emergency care or whatever. You have to put all that into perspective so that it won't be like, oh, I'm here and I don't know where to go if I need something. So, yes, definitely that is something that you need to take into account, healthcare. And as you said, some people just come back once a year or a couple of years to do their clinical, physicals, get, recommendations. So, for their medications and stuff, and then they move or go back and see them. But you can live there. We are not saying that you can't live there because there's no healthcare. There's healthcare. You can live there. But if you doubt the quality, you can always go back once every 2 years and do your own American checkup and then come back.
But we also have some doctors that have practiced
here that have moved
in America that have moved back. So you just have to, like I said, have the money to be able to pursue such doctors. They have their private clinics that charge a little more than the regular hospitals. So they can also be available.
But even that little more may be nothing to you because, again, your income is different. Yes, exactly. So yeah, there's but at least we just want you to put it in perspective as you plan so that it won't be like a trap, because we want to make people go with a full knowledge of what they are going to meet and plan towards that so that they won't pick up their bags and return after they have made that move, right?
Yeah.
So yes, that is definitely, but there are top-notch hospitals and clinics and pharmacies and healthcare. And the thing about African healthcare is you get stuff from everywhere. You get from the European Union, you get medicines from there. You get some from the UK. Now UK is not part of the EU. So from the UK, from China, from Japan, from India, everywhere.
And from America.
Because it's not like controlled that it has to be just made here. And so there's access in terms of medications. I know patients who had questions, and I told them, give me the list of your medications. And they are the same medications that we use here. Same. They use them back there. So it's just like you have to take care of yourself. You can't blame the system. So now let's move to the next one. This is another huge one that people talk about. Is it safe? Can I leave my family here and go and live there in Africa? What do you think?
Yeah, so safety, like we've written, right? Safety varies widely by country, city, and neighborhood. So, like we said, depending on where you live, so because we have gated communities out there, we have slums, we have, bad neighborhood, we have good neighborhood. So, depending on where you want to live, you just want to watch out for your safety too. You just don't want to hear of a place, then you just go by. You really have to do your homework and try to find the safest place possible, which is also readily available if you look up for it.
Yes. So, like everywhere, there's bad neighborhoods, good neighborhoods, bad taxi drivers. It's all it's like a slur. It's everywhere, just like here. So you just have to do your homework and make sure that you align yourself with the right people so that you don't just get attacked, because you become also a target, because especially if you live like I came with all the dollars, people look at me, this is me, I come from America, I come from the US, I come from Jamaica, I got all the money, then you attract criminals to you. But if you live low, you just live your life without all the noise of where you come from and stuff, nobody will do anything. And the other thing is this cheap labor. So people are able to hire 24-hour security, believe it or not, right?
Right.
People have what we call security posts at their houses where they employ people to guard their house. So before anybody comes to their home, they will have to deal with the watchman or the security person. You can't afford that in the US or in the UK, but people are able to afford that back there because the money there can buy a lot. You can pay somebody with less money just to do that for you. So it's all in the way you plan.
Right.
And obviously, if you go with much more, intention and planning, you take care of all those issues and you'll be fine. Doing the research also helps you to know where not to go to live or where to live, in terms of crime and stuff like that.